Thank you all for coming today. I appreciate folks coming to the public comment section. I'm Bernie Haskell with Health and Human Services, the community liaison. If we could give it maybe 1 or 2 more minutes just to see if anybody else filters in. I just didn't want to start if somebody's going to come in last second. I should say last second, but they're always welcome. Maybe another minute or 2.
Want that on?
Oh, there you go. That's better.
Right. Well, it was lit up, so.
Wait.
If it's lit up, it's not. Okay.
So it's one of the things we could kind of get out of the way. First of all, so we've got folks who are here and present in Lincoln. Omaha, are you there? Can you hear us? Hello?
Hello.
We're here.
Okay.
Omaha.
Thank you. North Platte?
Hello, we're here.
Excellent. And Columbus?
We're here.
All right. For anybody who joined us who didn't hear me say it earlier, if you ever have any teleconference needs, call NET. NET, these guys have been unbelievable to work with, just phenomenal. So again, thank you so much for allowing us to use the site. This has been very helpful. What we will do today is talk a little bit about the transition plan. Really, we're going to start with a very, very brief review of the CMS rule. And when I say brief, I mean very brief. It's a big, thick rule, and we don't really have the time to go through all of that. We'll talk a little bit about the site assessment process. The site assessment process is something that Dave Barrett, who's with technical assistance with DHS, who's over there, and I had the opportunity to do the last couple of months, going across the state, meeting with providers, individuals, and services to really get a feel for what those day services look like, as well as some of those residential settings. We'll talk about, I'll review the assessment data that we've gathered up to this point, and then open this up to public comment. And that's really what the intent of this meeting is, to take public comment regarding either the transition plan that I know that had been, public comment had been opened up in the past for that about a year ago, to see if anybody else has any additional public comment, as well as to make comment on the review data or the review process. My little note to myself is just out of respect for folks' time, for everyone's time, if we can keep focused on comments about the transition plan as well as the review process. If there's other topics, other things folks want to talk about or give feedback on, if we can kind of keep that to the end, and so that folks who are here specifically to do public comment about the transition plan or the assessment can kind of then be on their way, and then folks can talk about the other things that they wanted to share. And I apologize for how small that was for folks. I should have also mentioned on the sign-up sheets that have gone around, if somebody wants a copy, if you want an electronic copy of this PowerPoint, just drop me your email address. I'll send it over to you. Additionally, once we've got all the data entered in, we'll put it up on our website as well. So this will be available in a couple different ways if people want copies of it. But if you look at the Center for Medicaid Services, established a new rule in March of 2017, or 2014. The rule states that all home and community-based settings that receive waiver funds have to ensure that people live in the community and have opportunities to access their communities and receive services in the most integrated settings. What it means for all types of settings is that setting is selected by the individual who's receiving those services from the options that may include non-disability specific options. And that they also allow for privacy in those settings for the individuals who are being served. We want to ensure that the individuals that are being served have a choice of providers, that services and settings that they choose are documented in a person-centered plan, so that we can really track back and see this is how this came to be, that this person is accessing this specific service. That each person has a right to privacy and is treated with dignity and respect and is free from coercion and restraint. And that people have optimal opportunity for independence in making life choices without regimented daily activities. They can access their physical environment and may interact with family and friends just as people do who are not receiving services, waiver-based services. So what does it mean for residential services? Each individual has the same responsibilities and protections from eviction that tenants have under state or local landlord or tenant laws. If such laws don't apply, a lease or other legally binding agreement is in place to provide for those protections. That seems to me to be a pretty straightforward, obvious expectation that we would have, that if there's a law that protects what kind of notice somebody has to give me before I have to move, the folks we're serving should have those same protections. Each individual must have privacy in their sleeping unit with a lock and key controlled by the individual and appropriate staff. Individuals must be allowed to furnish and decorate their own sleeping and living arrangements, and have access to food at any time, and have visitors of their choosing at any time. And individuals sharing a living unit must have choice of roommate. The rule does clarify in which home and community settings cannot be provided. These settings include hospitals, skilled nursing facilities, institutions, intermediate care facilities. The rule defines settings that are likely not community-based as any setting that's located in a building that is publicly or privately operated facility that provides inpatient institutional treatment, a building on the grounds or immediately adjacent to a public institution, or any setting that has the effect of isolating individuals receiving Medicaid, HCBS from the broader community of individuals not receiving. Recognizing as we go through some of the data, when we did some of the site assessments that Dave and I took part in, we had the opportunity to meet with Courtney Miller, who's not here yet, but she'll be joining us, who's our interim director of developmental disabilities right now. And as we talked about some of the settings that we think are not likely to meet the current Medicaid, the way that things are written, really I think we're charged as a state and as a state entity of figuring out, if they're not meeting those requirements, could they meet the requirements, or do they meet that heightened level of scrutiny that we want to go back to Medicaid and really advocate on behalf of some of the providers who really kind of come to partner with DHHS as well as families and individuals to make sure their needs are met. So the site assessment process. We have until 2019, we as a state, every state, to ensure compliance with the Centers for Medicaid and Medicare Services ruling regarding the home and community-based services with all providers. If providers don't achieve compliance, HHS will not be able to pay them at that time. So it obviously is the state has an extreme vested interest in making sure that we all are compliant with the rule for several different reasons, but mainly I don't want to see any individuals receiving services or families or anybody else in our service in our state, within our stakeholders group, in a difficult spot where suddenly we can't utilize a provider. That's not going to be helpful for anybody. So during that assessment phase, Dave and I had the opportunity and at this point we've assessed every day service location in the state of Nebraska, as well as every CDD in the state of Nebraska. And our role was really to develop a baseline. So what I would tell providers when I go out, which is true, no one's getting a checklist from me saying, you did these 5 things, here's your gold star, or fix this. This truly was a baseline assessment for us to be able to report back to CMS. We've been everywhere, we've talked to everyone, and this is where the state is as of today, knowing that we have until 2019 for some of the sites and some of the places that may not be meeting those the new rules. We've done some public meetings. We've done 4 public meetings at this point. We've got today that's being broadcast obviously in 3 other sites. We're doing an additional public meeting tomorrow in Omaha at the Nebraska Autism Center at 90th and Q. And then we'll be doing another one on Monday in Kearney at the public library. So if you want to attend any of those, feel free. If you have folks that you know who you support, or guardians or parents in any of those locations, you can definitely feel free to give them to pass that information along as well. So current data. So over the past couple of months, we've compiled the data assessment based on the tools, and the assessment tools are what we sent out to providers before we started the process, which came from the Center for Medicaid Service. They had a little toolbox on the website, and they had some assessment data or some assessment tools. The information that is going to be reflected here is information that is that was through the 22nd through the 18th of September. I needed to get the PowerPoint to NET, so I didn't add the 2 days worth of assessment that we did at the beginning of the week. However, for the public comment meeting tomorrow in Omaha, as well as the one in Kearney, the additional data will be added in, and that will also be in the information that's uploaded to the website. So at this point, Dave and I had assessed 115 out of 129 of the CDDs in the state, so right under 90%. What we were looking for in those site assessments, we looked at location of the site. Is it in a residential neighborhood? Is it not in a residential neighborhood? What's access to transportation look like for the individuals who live there? What's the overall character of that home in context with the surrounding neighborhood? So the questions that we really looked, that we assessed, was looking first at, does the setting provide a home environment, meaning it looks like any other home in the neighborhood and does not look like a setting for people with developmental disabilities? We're, as a state, doing fairly well with this. A little over 98% of those residences that we looked like met that standard. The setting's not adjacent to another setting, such as a workshop or another group home or another apartment with folks with disabilities living in it. About 96% of the homes that we looked at met that standard already as well. And that the setting's in a residential neighborhood, residential in character, among other private homes not owned by the provider, and that was 99% of them. So as a state, when we look at our residential side of the services that are being provided through the waiver, we're doing fairly well as far as moving towards compliance on that CMS rule. Going on, the setting is not located in the same building as an educational program or school, 99% of them. And the one that was, I don't think we have to do a whole lot of work to bring them into compliance fairly quickly. And then transportation, public or not, is available to take individuals to non-health activities such as shopping or other recreational things. In Nebraska, for the private providers, you will know this, it's written into your contract to provide that kind of transportation for residential. So it didn't surprise me that there was transportation available, which would be the or not, but as far as public transportation, there's not a lot of public transportation that's available, and that will be highlighted when we talk about the vocational side.
Very quick question. This is all just private provider information right now?
Correct.
Thank you.
So, when we looked at the day programs, Dave and I had the opportunity to see 126 out of 141 of the day programs, so right under 90% of them. And that, looking at everything from workstations in industry, vocational planning, ICE, workshop habilitation, supportive employment, hubs or off-site stations. There were 2 sites that were considered not applicable, and 4 actually had been closed by the provider for just different reasons. And so, for folks who actually want to look at all the PowerPoints, that end number of how many sites we were going to review goes up and down based on what we found. So I didn't want, although I can assure you all, I'm not a mathematician, I'm not a statistician. I usually can count to 150 pretty well. So that's why those numbers change from time to time. So our day program assessment included items such as evidence of community integration, informed client choice, the physical characteristics of the facility, and again, that access to transportation. So as we started looking through the, talking with staff at the facilities as well as talking to consumers, we were looking at, does the setting provide meaningful non-work activities in integrated settings for the period of time desired by the individual? I bolded the meaningful and desired by the individual because as I was doing these assessments, I had to keep reminding myself that that is the standard. So just because somebody might leave a little bit of the day, is it meaningful and is it that level that's desired by the individual? And at this point, it was looking at 35% of sites were currently meeting that. I should also clarify, you're either compliant or not compliant. So when we looked at this, some folks were already doing a lot of good work in trying to move into becoming compliant with that rule. But for this assessment, it was either, yes, they're there right now and we're perfect and there's nothing we need to do more, or there needs to be work. So I don't want folks to leave here thinking, 65% is doing nothing with this. That's absolutely not true. Most of the providers have been very open and are starting to work on their plans on how they're going to meet those standards. Interests of the individual are the primary focus when establishing schedules and activities. We saw evidence about right under 50% of the sites for the individuals we were talking with met that standard. Individuals are provided adequate information to make informed decisions about activities, including but not limited to competitive work, shopping, cultural activities, social activities, and volunteer work. And again, about 50% right now are already showing that kind of evidence. So that, to me, is a very impressive, it's a very encouraging spot to be. The setting allows for freedom of unrestricted movement between rooms, both inside and outside of the facility. We saw evidence at 97% of the places we went where folks do have that freedom of movement from room to room, maybe building to building if they have multiple buildings on one site. The setting's located in the community among other businesses that facilitates that integration with the greater community. We're about 89% compliant there. Kind of on a side, several of the providers that we work with, somebody maybe donated land to them. Counties maybe gave them some space to set up either a sheltered workshop or a day site. So for some of the providers, it wasn't that they intentionally built a day program, kind of down the county road. That was the land that was donated by somebody. And so recognizing that there's probably a reason that a provider may be in a spot that's not meeting that standard right now. Those are the conversations that we'll need to have kind of between the state and providers as well as our partners with CMS. And there's evidence that the setting encourages people from the greater community to be present, that their presence is not time restricted, and that there are meaningful interaction opportunities afforded. This is a question that I thought it was an interesting question because the push or the onus is that we would integrate folks that we're supporting into the greater community. So I seemed a little odd that we would have a question about bringing folks on site. However, there are some providers who do have some stores, some retail outlets, and so really kind of putting that back if we are going to have those opportunities for the individuals who support to work at, really is the general public coming in? What kind of foot traffic are they getting in, those types of things? So if it's an employment setting, there's evidence that the individual has had the opportunity to negotiate their own schedule, benefits, and break times to the same extent as individuals not receiving services. I did these as yes, no's. A lot of these were actually probably not applicable because they weren't work settings, but if they weren't, I just included them as a yes. There was really only one site that, as we were talking, it appeared that the folks that they're supporting are not negotiating their schedule at the same level of folks directly employed by that company. Transportation training is offered, so both public and private options of for transportation. This really gets at that statement I made earlier on. There's not consistently across the state access to public transportation, and so there's several providers who I know would be more than happy to do transportation, training on how to access public transportation. I'm not sure why they would do that because it's not available in that area. That seems like a lot of wasted energy if it's not something that's available for someone to utilize. And then looking at the tasks and activities and how comparable they were to people of similar ages who did not receive services. That was about 86% of the sites that we visited. The tasks and activities individuals were doing were very comparable to folks of similar ages. Looking to see if the setting is physically accessible and are physically modified to allow access in all areas, such as all the break rooms, bathrooms, public areas. And we were at 99%. There was one that wasn't quite there yet. Individuals have been given an informed choice regarding their day program provider. This is another one of those questions that's difficult to answer. In some of our areas, there's only one provider. Not that they're not doing a phenomenal job, not that they're not doing the best they can to help support and meet people's needs, but the reality is, at the end of the day, there is one provider, so I don't know how much choice that offers some of our folks. And that the setting allows for a mix of service delivery, meaning a combination of competitive employment and community access. So at that setting, can somebody spend maybe an hour or so of their time maybe working on some programmatic stuff, but then leave and go work competitively? Then maybe come back and do a few more things, and then leave and maybe go access the community, do something recreationally. And so 78% were meeting that criteria. We looked at whether the setting was meeting all HIPAA guidelines. Simple things like schedules for OT, PT, speech, diet restrictions, medications. Are those visible to folks just coming into the site where they can see maybe what services folks are receiving or not? Are they kept in a private area? Or if somebody receives those services on site, is there a private room that they can go to receive that physical therapy versus doing physical therapy and here's all my peers kind of sitting around watching me do physical therapy. At this point, 86% were already meeting that criteria, and the providers that we talked to who weren't were aware that they weren't and were already actively seeking, probably prior to us getting there, how they could do that differently. Does the setting support individuals who need assistance with hygiene, toileting, and appearance? 100% of the sites that we went to did offer those supports and had adequate space for that. And that the interaction between staff and individual was respectful in the manner of how the individual would want to be addressed. I would expect when the state reviewers, state folks are there, that interactions would be appropriate. They were very respectful. I also have faith that they're typically respectful as well, but everything that I saw was respectful. The setting offers a location for individuals to securely store their belongings. This is an area that only a little less than 50% of day service providers had that availability currently for individuals. And then there's evidence that that information on individual rights is provided. That's at 100%, mainly because that's part of the DHHS paperwork when providers take on and we serve and we kind of go over individual rights. So as a state, we're doing well on that as well. As I said, and then I'll open this up for public comment. We have 2 additional meetings. One is tomorrow in Omaha at the Autism Center at 9012 Q Street from 3 to 4. If there's anybody in the Omaha, Lincoln kind of surrounding areas that wanted to be here but couldn't, please encourage them to try to attend that if possible. And then we'll have one in Kearney on the 28th from 5:30 to 6:30. Although you're here to give public comments, which we'll take, there's a lot of information on here. All of the information regarding alternate ways to give public comment, whether folks want to do an email, fax, go on our website. If you go to the HHS website and go to the developmental disabilities page, there's a whole transition page. There's like several links down there that can get you any of this information, as well as a way to contact the department if you would like to make additional public comments. And then there's just some additional information as far as if you're looking for greater depth of information. Obviously, the HHS website for developmental disabilities page is a great place to look, as well as the Center for Medicare and Medicaid Services. They have some very, very helpful links and some very, very helpful PowerPoints that really, it's the most current information we all do. They're really extremely helpful as far as trying to understand the context of the rules and things that they're wanting. They may not have all the details that we'd all probably want, but at least it gives us all kind of the same foundation of this is the intent, so let's see how to work that. So with that, I'll open it up to public comments. For folks who may or may not know, the meeting for public comments is being recorded, so you won't see me feverishly writing them down because we'll have a recording of this. But I don't know if the easiest way to moderate this is to start
Excuse me.
Yes.
Could we get those websites up again so people can write them down?
And we can't see them.
Absolutely.
And we can't see them, so they may have to be enlarged.
Okay. I'll put those up. Do we have public comment that people want to about the transition plan or about the site assessment? Because that's really kind of the intent of today. And then once we have those comments, we can open it up to other comments.
Yeah, you don't ask them to read them.
Can you go ahead and read those
Okay.
websites or links?
The HHS Developmental Disabilities website is http://dhhs.ne.gov/developmental disabilities backslash pages /developmental disabilities index .aspx.
Right.
Jeanette and Kim, I'll email you that. I'll email you the
Go ahead and
link.
get it clarified.
Yeah.
Will you email me the link too?
Yeah, and I think I still.
Just give us the comment. Could you just give us the comment one?
And I think I still have your email as well. I can CC.
I don't need it. I have it.
Okay.
I just thought anybody else in the room.
Hey Dave, do you want to come up and do the email, work on the computer and blow up those 2 links to send them out so folks can see that better? Maybe to put them on a different tile. Okay, sorry about that. Any public comments that folks wanted to start with? It's a quiet room. I don't have a floor show planned.
This is Omaha calling. One of the things that I thought that I had read in the initial guidance that came out was that the size of setting was an issue or a criterion related to residential services. Can you speak to that? You talked about surveying CDDs, and I know in some cases CDDs are 3 or less people, but in some cases they are quite a few more. So comments there.
Well, I guess the comment, and I hope this answers that, CDDs 3 or less does not need to be a licensed CDD, and those residences were not residences or the sites that Dave and I reviewed. We reviewed only licensed CDDs, and you are correct. Any of those, they had anywhere from 4, some of them had up to 10 individuals who lived there. I don't know if that answered the question or.
Well, the question is, it was my understanding that in the new waiver requirements that settings that large were not acceptable for HCBS funding.
And I guess what I can say is, I don't know that I can answer that, but as far as a public comment, if I could rephrase the public comment as, can we get clarification regarding the size of CDDs and whether or not any number of folks are limited by the new rule? Is that kind of what you were?
Yes, that sounds
Okay.
about right.
All right, thank you. You had, okay,
So you said that these visits were baseline
correct.
visits or assessments. Will there be another site visit and assessment, and will providers receive specific feedback to their locations?
There'll be something. I know that there will be something. I don't know as, and for folks who didn't know, I'm going to call her out. Courtney Miller's our interim director, and she just stepped in. We are going to be doing some work with this transition plan with our team and start having that conversation as well to really kind of figure out what our next steps are, and obviously we'll communicate that to providers, individuals, and services guardians as well.
Dave, I know you're diligently working to get that up. Could you just read the comment link that we need to use? I think people are concerned that we have such a short time frame to make comments. So if you could just read that particular link, that might be helpful.
No, there was a different one, actually, the link to get the public comment to.
Okay, it's dhhs.hcbs public comments at nebraska.gov.
Thank you.
Okay, welcome. All right. Other questions? Michael?
Sure. A couple different things. One, and that's why I asked the question earlier, private provider only. Is there a plan to do state-run
Facilities? I would say that currently, if they're not receiving funds based on those Medicaid
Right, yeah.
dollars, then we would not.
You wouldn't do it. So only, but if there are any receiving, are there any receiving Medicaid dollars? I thought there were.
I don't know that I can speak to that.
Okay.
I don't want to speak to it and
Sure.
misspeak.
Yeah, and if so, then who's going to do the check on that? You can see the inherent
Yeah.
issue of transparency on that one. So, who would do that, and maybe that could be answered. And there might not be any. I thought there was, and I couldn't even mention them. I don't know what they are offhand. I just thought there was.
So the comment, if there are state-run facilities that would fall under this rule, who's going to do those evaluations? Because it would be
of transparency issues.
Okay.
Certainly.
Thank you.
Second, I don't think I want to rehash all of the comments that I had made during the first round of public comments. However, I do want to go back to one of those public comments that was answered in the first go-around by the previous administration. I had specifically talked about a situation that a person who's receiving services here in the state of Nebraska was told that they either went to a day program or they were going to be dropped from services completely. The comment was taken as though it was a private provider who had made that comment. It was actually a state worker who made that comment. And I can provide specifics at another time. I don't want to get into that for public record. I just wanted to clarify that it was actually a state person who had said, you will either go to day services or you will be completely dropped from any services. That's not necessarily within the rule as I read it for person-centered planning.
I would agree. Now, in the situation, based on what you've told me, I would
Right,
agree.
yes. And like I said, I would be happy to provide specifics privately. Thank you.
Anyone else in here before I turn it to the TV people? Okay. Columbus, any comments from Columbus?
Yes, I have a question. After 2019, what does the process look like for determining if a provider is either compliant or not compliant with the new rule?
I don't know that I can answer that because I don't know that we know at the state what process we're going to do to make sure that folks are compliant prior to that. So that will be as the state, once we get a good handle on that, and we reach out to kind of work with our partners within the private provider world, as well as some stakeholders and advocacy groups. Hopefully we'll be able to better answer that, I would say in maybe 6 months or so. That would be my time frame that I would hope to have some answer to that.
Another question I have is, regardless of all the rules and regulations that you impose on our loved ones, how does that affect the ISFP? If I want my child to be at a service provider all day long, I don't want him to work, I don't want him to go anywhere, is that going to be okay? Or is that going to get overridden because of the rules that you're implementing?
And I don't know that I can answer that.
Yeah.
But so would it be helpful? I'm just trying to think of when I think about public comment. So if I can articulate this back to make sure I understood the public comment, is there's a question as far as if you have a parent or a guardian, and how does this new rule affect their ability to make decisions for the individuals that they're supporting? Is that kind of the crux of that
Correct.
question? Okay.
Right.
And like I said, I don't know that I can answer that, but it's an excellent comment and an excellent question to get clarification on.
When will we know then the answer? Today yet? Tomorrow? When?
You know, I don't know that I'm real comfortable giving a definite time frame on that because I don't know. Prior to 2017, and that sounded snarkier than I meant it to, but obviously we've got a vested interest as a state to make sure that folks get the appropriate level of intervention and kind of are living the lives that they want to live. So all I can say is my intent would be that folks would all work together to figure out how this best fits with each individual, kind of staying within the new CMS rule.
Well, who's going to make the decision what's best for the individual? You or the legal guardian?
And obviously I'm not going to make that decision, I can tell you that much, but
Well, you know what I meant.
excuse me, say that.
I think you maybe knew what I meant. I didn't mean you personally, but
Right, okay.
who is going to make the final decision on what is best I get to make the decision as the legal guardian of my child, or does a state get to make that decision?
I would say a legal guardian always gets to make final decisions for the folks that they have legal guardianship over. How they access and what services they access and what those look like, a lot of that's determined by what the service definitions are and what the waiver allows for. And so, not to sound Pollyanna, but I believe typically decisions, folks can get together and work these things out, and we usually can find a solution to them. So I think I'm probably not going to be able to answer that question right now, but I don't think we're anywhere close to lines in the stand where folks are saying, well, I absolutely don't want that, and so, folks aren't getting services. I don't think we're at that stage.
Can you tell us now if we have an individual in a daycare, or not a daycare, but a day service, can you tell us now if they've met the criteria? If we give you if we say the service name, can you tell us now, or how do we find that out?
The provider name?
Yes, the provider, I'm sorry.
Okay. Well, and actually what I told providers is I wasn't going to send them kind of a report card, because that's what I was trying to avoid, because this was a baseline. But I would say that the provider that you currently access, they're well aware of the CMS rule as well, so they should have an idea kind of where they sit as far as how close they are to meeting some of those standards or not.
Okay.
One other question that I do have is, if my child is receiving an OT or PT services at the service provider, do those services have to be by the specialist, or can they be provided by a staff member that's been trained by the specialist?
I guess it would. I really don't know the answer to that. I know that typically OT or PT will work with somebody, and then once they feel like they've kind of done what they can do, they kind of move that on to staff, train them so that they can continue with that. I don't believe the CMS rule has any bearing on that.
Okay, thank you. Anyone else have any questions?
Anything else from Columbus?
No.
Omaha?
Nobody spoke up quickly, so I'm jumping in. One of the things that I've seen going on in terms of providers in this area is that a couple of them are putting out statements saying that at the end of this process in 2019, there won't be any sheltered workshops allowed in the state. Can you clarify that? If that's part of the requirement?
What I can clarify is sheltered workshops as have existed in the past, the Monday through Friday 8 to 4 contract work. My understanding, and I think it's a fair statement, was that CMS would say that those do not meet the new CMS expectations or the guidelines. But I don't know that that means that nobody can have a site where folks go parts of days and spend time. It was really the intent. My understanding was, again, community integration and informed choice, so that we're not having folks in one location all day long in a non-integrated setting.
Thank you.
I have a question related to how the new CMS regs relate to the Federal Workforce Innovation and Opportunity Act, and specifically regarding sheltered workshops. Has there been any discussions between VR and DD Services on how these are going to kind of come together?
That is an excellent question, and I don't know the answer to that, but that's a good public comment to add in, because I don't know.
Okay.
Another question, this is more of a process question. Now, the state has submitted its transition plan, correct?
Yes.
And was that transition plan accepted?
Nebraska's has not been accepted at this time.
Is this process related to that, or is this just an attempt to gather more information?
The This process, meaning the transition assessments that we've done, that Dave and I went out and did.
Not the assessment, I know that's part of the process, but the additional public comment.
I think well, I shouldn't say thing. The additional public comment came out of our former director, who's not with us any longer, but our former director, it was her interpretation that along each step we would need to do public comment. I think we're trying to get some additional clarification on that.
Okay.
Not that I don't enjoy getting public comment.
Not a problem, thank you.
One additional question, and I don't know if it's really pertinent to HCBS right now, but I believe that the state just resubmitted the DD waivers, like renewals. Is that accurate?
We will. They're due by the end of the month.
How did you advertise public comment for those?
I know that I believe they were posted in the paper and as well as on our website for public comment, but that's my understanding of how those were done.
Okay. And locations to take public comments, where were those at?
I believe they did those only through, we offered folks the ability to call or send written feedback.
Right. My understanding is that just like HCBS, is there not also a requirement to make sure that public comments are taken for the renewals or any kind of amendment on waivers as well? It's just a question.
I believe so. Courtney's shaking her head, and I trust Courtney's judgment. So yes.
One other quick, it got quiet, so I have to talk, right? One of the things that I've heard in relation to not only the HCBS waiver changes, but also the Workforce Investment and Opportunities Act, is that there's an increasing focus on competitive employment, and that it's like employment as the first option. Was that part of your assessment in any way, or because I saw you speaking about competitive employment at one point in your discussion of your assessment of day services, but it seemed like it was kind of mixed in and wasn't really kind of a primary focus. Can you comment to that, or at least, I'm not sure how to frame it. Where does competitive employment come into this process?
For the assessment that we did, that wasn't at the forefront. It was more of the sites that we reviewed, could people access competitive employment utilizing those sites, at some point during the day. So that was not part of our assessment to look at. Was competitive employment the first service or the first thing that teams looked at prior?
Okay.
I have a question in Columbus on, do you have like a working definition of what a workshop is? Is it just like a factory sort of setting for folks with disabilities with no other outside employees? Or is it considered a place that a person goes all day long and stays from like 8 to 4? Or just some clarification on what a workshop is? There are service definitions for each type of service that's provided that DHS uses Medicaid funds to reimburse. And so if folks are interested, I can, if anybody wants that information, I can email those definitions out if people are interested in seeing what the actual definitions are. That would be great.
Just a point of clarification on one of Mark's questions. He had asked about the plan, whether it had been accepted or not. Because I'm not sure if I understood the answer. But anyway, it hasn't been necessarily kicked back. It just hasn't been approved yet.
Correct. Actually,
so it's still sitting with CMS.
There was a Medicaid call yesterday, and what they had said is about 2/3 of the states have already gotten some feedback. The other third has.
Okay. So it's not necessarily, it hasn't been kicked back, it hasn't been declined, you just haven't heard a response yet.
It's still under review.
That's okay. That was a brilliant point.
Anyone else? Other public comments?
I'd like to comment on the workshop thing. I'm not sure that I understand everything, so I'll make the comment and then do it. Would you please? I live in Crete. I brought my son Phil along with me today. Phil goes to his workshop every day, and in Crete they try to provide him with as much work as they're able to provide. So my concern is that if you close the workshops, what is he supposed to be doing in the time that he is there? There is no work for him. He can go to the work that they've created for him, but where does he go when they don't have work? He lives with us, and we are very pleased that he is able to stay at home with us, and so we'd like to keep that arrangement. So if he is not working, will he be staying at home with us the rest of the time, or will there be some other plan for him? If they close the workshops, it is my opinion that there must be some alternative for the people who are being served to do something of their choice that they would like to do. And while I'm not speaking for Phil, it is my opinion that Philip is most happy in being in his workshop environment with his other people because he likes routine.
It's not something I can really speak to, but I appreciate the comment. That's an excellent comment too for us to add into our transition.
My sister also is at the Crete workshop, and if she didn't have a workshop, she would not have a competitive employment. She has no place that would accept her as an employee. So, as he just said, what is she supposed to do? Sit and watch soap opera network all day? That's my comment.
Okay, thank you.
So going back to your day program assessment, when you're talking about the setting encourages people from the community to be present and have meaningful interactions, those opportunities offered, and you mentioned businesses and stores. So what if we're looking at a setting that isn't a business or a store? What kind of interactions from the community are you looking for?
Well, the standard that we're looking at is that is the general public invited in for non-time limited amounts of time to have meaningful interaction with the folks that we're supporting in those sites. And so for most day sites, it's going to be difficult to achieve that, especially a very a site that's not an integrated site. So that's the standards that we're using. And I should have mentioned, if you get on the CMS website, they have a whole toolbox around the CMS rule that can give you just, I thought it was very interesting kind of interpretations and some tools to help you do some exploring with the services you're providing. Other questions or public comments?
What are your next steps from here? Could you reiterate those, please?
Next steps will be for the department to work internally, review the transition plan that's already been submitted. Once we get the feedback from CMS, see what changes or suggestions that they have with that. And at that point, then we open back up to then our providers and stakeholders, as well as advocacy groups, and we'll keep going down this process.
Thank you.
Could we go back to that public access piece? Do you have an example of what that's supposed to look like?
I don't have a good I can tell you one of the examples we saw.
The doors are supposed to be open and people are just supposed to be able to wander in.
A perfect example, Dave and I had an opportunity to go to a provider who has a secondhand store. We've actually saw several.
Okay.
Some secondhand stores, we went in there, we were the only people in there, and I don't know that anybody goes in there. We went to another one, and this place was cram-packed with folks from the community in and out. I mean, every area of this store, very, when you think about an integrated, meaningful opportunity, the folks who were being supported there were the ones helping the individuals in the coffee shop. They had a lot going on as far as, and folks from the general community truly were welcomed in there. It wasn't time limited, and there was good interaction. So when you think of that's the type of environment that I think of. I don't know if CMS had a different rule with it or a different idea.
So would that be, your example would be Angel Works in Omaha?
I don't.
Angel Works.
Okay.
It's on Maple. They have a thrift store. They have a cafe. They, it's a workshop. Hiring all people with disabilities, but it's totally open to the public. They have the restaurant, the thrift store, the woodworking.
Okay. Now I remember what you're talking about. My head wasn't catching on. Those are open. Those would be integrated and open to the public.
So that would be like the ideal.
I hate to say that this is or this isn't until we have better clarification from CMS on some of those sites. What I've told every provider is every step in the direction towards increasing integration and informed choice, not going to go wrong as long as you're doing those things. But I'd hate to say, yeah, you guys perfect, everything's perfect if I don't without those, because I'd hate to have to come back in 6 months and say I was wrong. Don't do this or do that. We're not at that stage yet.
I do have one more comment from Columbus.
Okay.
Are we selling the ship here with no captain? Who is at the head of DHS now? And I was under the impression that somebody had hired a lady from Tennessee or Arkansas, and she was here for a short term. So if we're trying to make these transitions occur with nobody at the head, how are we going to be successful in doing that?
Well, I would say that we still have Courtney Phillips as our CEO, and she was acting. And we have Courtney Miller, who is our current acting director of developmental disabilities, or interim director. And so when you think about who's sailing the ship, those two are sailing the ship. So I have full confidence that we're in a good spot having people in those roles. And I would agree that for a while it was a little bit, it didn't probably go as well as we would have liked to not have somebody right at the helm, but we're there now.
Okay, thank you.
Any other comment?
The only last comment that I have is that I'd like to thank you for opening public hearings up across the state, providing video conferencing, and making it accessible for people to provide comments. So thank you for that.
I appreciate that. Thank you. If folks are done, you don't have to stay the whole time. It's kind of like class. If you're done, you're done. I don't want people to feel the need to stay here and stare at me for a thing. I have no floor show put together. I got nothing.
I paid for
Is this being videotaped?
It is being recorded, and it will be also put up onto our website.
Thank you, Bernie.
Thank you.
Thank you. There.
Oh, never mind.
These are leaky, yes, So instead of where it is right